Welcome to Adapting Class and thank you for joining us. So, as you know, prioritization is very, very important in your NCLEX. So, I always try to get you in the spirit that when you master it, it make the NCLEX doable. So, let's try some of the key aspects of concepts related to NCLEX. Most of the prioritization questions are concepts that they put it together. You look at this picture, you said, "Well, this can be difficult. What kind of prioritization is this?" It's just infectious control. That's all. How much infectious control do you know? If you look at a picture, have you looked at it before? You know what to expect for specific disease process. And this is aware of what? 4 clients in the emergency room. They all came to the emergency room. Which client should the nurse assess first? Client with this rash. This is the rash that you see. Client with this rash, this guy. And a client with this rash, that one. And a client with this rash. You have 4 rash in front of you. Can you recognize what kind of condition will cause this problem? Expect the NCLEX to do the infectious control. Now they can give you pictures and they don't tell you the disease process, but you have to be able to recognize what is being asked. I'll help you. This is a sandpaper rash. What condition causes sandpaper rash? You can see these are vesicles in it. It's a bunch of vesicles. It's fluid collecting, and it's an infectious control. Which of the infectious control disease give you these vesicular lesions? And this is what we call bullseye. What condition give you a bullseye rash? And this is a slap chick. You got to take it further. Infectious control, sandpaper rash, is scarlet fever. Then you go to the next level, scarlet fever. What do you think? What kind of disease process will do that? Right? What is the problem you need to know about it? Think about it. Vesicular lesion. What do you think? In a Lyme disease versus you have a slap chick rash. You know it's this parvovirus, right? And this, you know, this is all staph infection. And this is a vesicular lesions. Mostly for this condition, you can see is this is a varicella-like lesion, right? And this is a bullseye. That's a Lyme disease. You know, this is a Lyme disease. It's a standard precaution. And slap chick, when they develop this, it's a standard precaution. So a vesicular lesion is more important. So that patient, you need probably airborne precaution. Okay, so that's the first one. The second one, which client should the nurse assess first? Same thing. The nurse is aware of 4 clients. Who is sick? Who you don't have time with? Who, when you leave, they all have a problem, but you have 1 second to look at it. Is it a breathing issue, electrolyte shock, sepsis, airway, and pain? That's what I call B sharp. If you don't see it, look at if it's an expected finding. And if they are all expected finding, which expected finding is concerning? The next level, this is pharmacology. Don't freak out. Don't worry about it. Ask yourself, I take aprazolam. What is that? Benzos. What happened to him? I feel dizzy. What do you think? Is a downer. It will make you feel dizzy a little bit. Is this mean you are in shock? No, that's the medication side effect. You have to be sharp about it. Citrulline, right? What is that? It's a SSRI, right? Patient is reporting excessive sweating. You think if I give you citrulline, you're going to sweat? That's an unexpected finding. You have to be sharp about it. That is sepsis and shock. Aripiprazole, if you don't know it, this is antipsychotic, right? It's a 3rd generation. Patient is complaining of mild headache. It's not dying from it. Duloxetine, it's another SNRI. It's complaining about what? Constipation. That is the side effect of that. What do you think? Constipation, headache, excessive sweating, and dizziness. You can tell. Don't get trapped with number one because that is alprazolam. It's a sedation medication. It's not a big problem. But SSRI and you sweaty, I know it's serotonin syndrome. I got to worry about you. So that's your right answer, number two. So this is the way you got to go through these mental process, and you will figure it out. Once again, content-based prioritization. What is the priority action, right? A client with diabetes mellitus, okay? What is the problem? His sugar is 350, too high. He has fruity breath. Oh, that's a problem. And he has Cushman breathing. What do you think? Then you go to your content, you ask yourself, you say, hey, if I have a diabetes mellitus, okay, and I have a blood glucose of 350, that's a problem. At the same time, fruity breath is not good. Prioritization 101. What brought them to the hospital is dehydration. So fix the dehydration. So this question, this patient is going to get medication, most likely IV fluid to slow them down. So next question is this. Which client is appropriate for discharge? It's not only you have to know who need to stay in the hospital, who you need to see first, but who is ready to go home. Whoever is ready to go home, you fix their problem. This requires some content analysis, right? And this is to determine which client to discharge to create a bed for a new critical admission. So look at the situation. Post-op appendectomy. I already have surgery and I'm walking around. My blood pressure is normal. Should I go home? I have AFib. I've been started on warfarin. My INR is 1.1. Should I go home? I have diabetes. I've been admitted for ketoacidosis and I'm receiving insulin. Should I go home? I have asthma, experiencing moderate wheezing after nebulizer treatment. Should I go home? Who condition is stabilized? Asthma patient still wheezing. Diabetes patient still on IV insulin. AFib INR is still not normal. That means it's not therapeutic. Therefore, appendectomy patient should go home. It's fine. Go chill. Okay. And that's the way I would see that question. So this is the way you should figure it about it. Number 5. This is a content that you should be able to analyze. Magnesium is a very easy question, sometimes difficult. It goes either way, and they will ask you a lot of questions because of OB. So know everything about magnesium. And this question, I like that. A pregnant client with preeclampsia is on magnesium sulfate. Why? We want to prevent what? Eclampsia, so that she doesn't have seizures. Which finding require immediate intervention? That means which finding should I intervene if I see it is bad? If I give you magnesium for preeclampsia, I want to prevent what? Seizures and eclampsia. That means magnesium is a neurodepressant. It depresses your nervous system, not your nervous system. It depresses everything. When I give you magnesium, that means your magnesium level is high. Your heart rate goes down, your respiratory go down, urine output go down, your brain function goes down. But how low do you want them to go? Reflex of 1 is not 0. It has gone down. Okay, I don't like it. Respiratory rate is less than 12. I don't like it. Blood pressure is normal. Urine output is normal, right? For magnesium, I want you to know these numbers. Respiratory rate of less than 12. Intervene. Saturation less than 95. Intervene. Okay? Reflexes. Areflexia, no reflexes. Intervene. Right? Those are the urine output less than 25. Intervene. And they are loss of consciousness. So if they are somnolence, yeah, you got to intervene. And therefore, this patient respiratory rate of 10 is worse than reflex of +1. Therefore, that's the right answer. But you can figure it out by going through this one by one, and you'll be able to know who is in trouble. Same thing. Who do you see first? Everybody is on telly, alarm went off. Who do you see? Which condition, which patient you have no time with? AFib, his heart rate is 120. Is he in shock? His blood pressure is, did I give you any blood pressure? If you have AFib, I expect your heart rate to be high. It's too high, is irregular, but there's nothing in the case that telling you they are in trouble. Sinus rhythm, and he has frequent premature ventricular tachycardia, contraction, is a warning sign. Check the electrolyte and make sure it's fine. VFib, he has no pulse. That patient is dead. Pacemaker showing paced ventricular beat. There's nothing wrong with it. That means the individual has a V-paced pacemaker in place. Who is dying? Number three, he has no pulse. Even if that they don't tell you he has no pulse, it's VFib. Ventricular fibrillation means your heart is quivering, is dying. See that patient. What do you think about this? After train derailment, that means train accident, who do you want to see? This is a triaging. You want to save somebody who is injured but is savable. If you have severe injury, we let you go. Somebody's leg is amputated and is lethargic. Somebody has concussion, his GCS is 15. Somebody have penetrating abdominal wound, his heart rate is 85. Somebody have multiple abrasion, no complaint. If you are the nurse on the field at this time, who would you prioritize? Who will you prioritize? Who does not have chance with you? His time is running out. Who do you want? This is prioritization 101. Who do you think you need to see? The person you need to see is a patient in shock. This is what I tell people. In shock, they have chest wound, or there's active bleeding that you can see. Who is in shock? None of them have chest wound, right? Somebody have abdominal wound, but it's hard to eat. It's fine. It's not in shock, right? He has multiple abrasion. He has no pain. GCS is 14. Of course, he's not dying. This guy amputated hand means he has bled. When your hand, we cut your hand, traumatic amputation, you're going to bleed. And when you bleed, you are in shock, you become lethargic. Analyze the question, and you can see that you can figure out the answer. Don't get trapped because the guy has penetrated abdominal wound. He's okay. Therefore, number one is in trouble. Think like that all the time. Don't worry about it. This is exactly one question that demonstrates that. Patient with hematological conditions, there's four of them. What is their problem? Who do you want to see first? Break it down. Don't read the whole thing. Look at it. Iron deficiency anemia. What is it talking about? Fatigue and pallor. Thrombocytopenia is reporting about petechia on the arms. Sickle cell is reporting sudden chest pain and a difficulty breathing. Polycythemia vera is reporting pruritus after warm. What do you think? This is something you look at it and say, oh, there are conditions of hematological problem. Which one of them is consistent as you expect it? If you have iron deficiency anemia, you should have fatigue and pallor. That's fine. Thrombocytopenia, your platelet is low, you're going to have bleeding associated with what? Petechia. Sickle cell with a sudden chest pain and difficulty breathing is acute chest syndrome. Bad problem. Polycythemia vera, the hematocrit is too high, so pruritus is easy for them. So three expected finding plus number three, which is also expected, but is severe form, chest pain, difficulty breathing. That's acute chest syndrome. We got to see number three. What do you think? What is the priority action? Patient has stroke. It came in 2 hours ago. Do you go and get a CT scan? Do you give them TPA? Do you perform detailed neurological assessment? Do you check their blood glucose? Do you have time to do all this? Which one will give you more information? Which one will save the patient? A stroke patient, be sharp. Ask yourself, what glucose, checking glucose, what would he give you? Doing perform multiple neurological detail one, what is he going to give you? Giving them TPA, what is he going to give you? Preparing to get a CT scan, what is he going to give you? The concept here, as always, I said, go back to the concept. If somebody come in with stroke and is within at least 4 hours, right? It used to be 3.5, now in 4 hours. If you come in within 4 hours, you have to make sure that you're going to treat them, whether with the TPA or not. But you can't do that unless you know if it's hemorrhagic or what? Ischemic stroke. The best way to know if it's hemorrhagic or ischemic is to get a CT scan. Of course, yes, I need to check if this stroke is due to what? Hypoglycemia. Yeah. Um, yes, I got to do neurological exams, but you don't need a detail. You need a very easy, simple neurological assessment. The time you're waiting to do a full neurological assessment, patient is dying. Time is a factor. 2 hours, we should get a CT scan, and if it's negative, then we can give them TPA to save them. So one is the right answer. And this is the last question. What do you think? It's all put together. Several clients. Who is the next going to see first? Type 1 diabetes. His glucose is 200. Are you okay with that? Type 2 diabetes is reporting what? Dizziness and sweating. Are you okay with that? Hyperthyroidism. He has a heart rate of 105. And Crohn's patient is reporting severe what? Bloating. What is your right answer? 4 patients, they're waiting for you. They want you to save them. Who are you going to save first? Like I said, you got to be sharp, right? Be sharp. This is what it is. It's not an order system. You just look at it, and if you see it, you got to look at it. And the S is what? H is hypoglycemia. This is hyperglycemia, right? I mean, is this shock? Heart rate of 105, is it shock? Dizziness, is it another shock here? Or is it something here? Bloating, is it sepsis? Ask yourself. Ask yourself. Blood glucose of 200, it's fine. I'm worried about hypoglycemia. Type 2 diabetes who is dizzy and sweaty probably has hypoglycemia, and that is in the B sharp. Hypoglycemia is more dangerous than hyperglycemia. Hyperthyroidism, your metabolic rate is high, you have too much thyroid hormones, your heart rate goes up. Crohn's disease, you're going to have some bloating, too much gas, that's all normal. Therefore, by elimination and content related, you know, 2 is the right answer. So this is the way I do prioritization, you know. Don't sweat. Just step back. Look at the question, look at it. The answer choice will be screaming at you to pick them. The trappy ones will be screaming at you to pick them. But what do you need to do? You got to stay your ground. Don't get trapped. Look for the B sharp. And if it's expected, ignore it. If it's, all of them are expected, which one is expected finding is more dangerous? The idea is if you have 1 second, who are you going to give it to? Give it to the patient who has a breathing issue, electrolyte, shock, sepsis, airway, hyperglycemia, and pain. And what kind of pain? Pain that is going to kill you. You're going to lose your life, limb, and eyesight. This is adapting class. Thank you for watching. I hope you learned something today. If you want more, you can subscribe to our channel or join our membership. And good luck in your exams. If you have a question, you can email me. But don't let prioritization be the only thing that is affecting you. It's going to be, if you master it, all the areas, question they ask you is all prioritization. So be able to know your content and then you'll be fine. Good luck. Bye.